Hi everyone. Today in this video let us discuss 8 important facts of Buspirone. What is this drug Buspirone? Buspirone is one of the azaspiroketone which is given in the form of buspirone hydrochloride. And this drug is an anxiolytic indicated for short-term treatment of anxiety. This drug is available under the brand name BuSpar. Buspirone hydrochloride can be used for short-term management of anxiety, but when this drug is going to be taken, few of the things should be considered because this drug can be given safely with few of the other drugs, but along with few of the centrally acting drugs, this drug is contraindicated. Care should be taken when this drug is taken along with few of the fruits. When few of the anxiolytics like benzodiazepines are replaced with buspirone, again, few of the precautions should be maintained in order to avoid few of the central side effects. So today in this video, let us discuss what are the 8 important facts that should be considered while you are going to take buspirone hydrochloride. First of all, let us see when this buspirone is prescribed. As we have discussed earlier, buspirone is an anxiolytic. So this drug can be given when few of the symptoms are observed in the patients such as repeated tension, increased anxiety, insomnia, lack of sleep, and intense fear with palpitations, sweating. If any of these symptoms are observed for more than 1 month, it may indicate generalized anxiety disorder, commonly known as GAD. In such conditions, buspirone can be given to control anxiety as well as other associated symptoms. But for the treatment of anxiety, we can have a category of drugs called anxiolytics. Benzodiazepines are the one category of drugs which are widely used as anxiolytics. We have the drugs like lorazepam, clonazepam, alprazolam. All these drugs are indicated for the treatment of anxiety and they are classified as anxiolytics as well as sedatives. On the other hand, we have another drug, buspirone, which is having few of the advantages over benzodiazepines. BuSpar shows somewhat less sedation compared with benzodiazepines, and this drug also has less motor as well as cognitive impairment. So these are the 2 advantages of buspirone over benzodiazepines. That's why in order to control the anxiety, sometimes buspirone can be preferred over benzodiazepines, particularly in the elders where motor and cognitive impairment is troublesome with use of benzodiazepines. In such conditions, buspirone can be given and it is available as a tablet at different strengths starting from 5 mg, 7.5 mg, 10 mg, 15 mg and 30 mg. Initially, it is started at low dose and the dose can also be reduced based on the patient conditions. But so many factors can influence the therapy with buspirone. So today in this video, let us discuss what are the 8 important facts that should be considered before taking the buspirone. First one, switching from the benzodiazepine. All we have discussed that benzodiazepines are well prescribed as anxiolytics, but when they produce few of the troublesome side effects such as motor and cognitive impairment and significant sedation, then these benzodiazepines can be replaced with buspirone. But buspirone is not the immediate replacement for benzodiazepines because buspirone belongs to the different chemical category and it is a non-benzodiazepine. So it will not act like benzodiazepine, but still it can reduce the anxiety by different mechanism. Interestingly, buspirone shows beneficial effects after 1 to 3 weeks of the treatment, so it will not produce any acute response as observed with benzodiazepines. That's why whenever these benzodiazepines are immediately stopped, it may develop few of the symptoms commonly known as withdrawal effects. So buspirone cannot reduce the withdrawal effects because it is a non-benzodiazepine and it takes at least 1 to 3 weeks in order to show its beneficial effects. So sudden replacement of benzodiazepines with the buspirone may lead to few of the withdrawal effects in the patients which just resemble the symptoms of anxiety disorder. So in such patients, we can observe insomnia, particularly observed during the daytime, increased anxiety, unexpected abdominal pain, muscle pain, and even it can produce flu-like symptoms, shivering and shakiness in the patients. And if it is untreated, it may also lead to the seizures in the patients. That's why benzodiazepine should not be suddenly stopped. Instead, the dose of the benzodiazepines should be slowly tapered over a few weeks. At the same time, buspirone therapy should be started such that it can replace the pharmacological effects of benzodiazepines slowly. So this reduces the development of withdrawal effects in the patients. So sudden replacement of benzodiazepines with the buspirone should be avoided in order to eliminate withdrawal effects. Second one is the restlessness. Already we have seen that buspirone acts by different mechanism. This drug acts as a partial agonist on 5-HT1A receptors. So it is a 5-HT1A receptor agonist. But apart from this action, buspirone can also inhibit the D2 receptors, the dopamine receptors, which are responsible for control of motor activities. So when these receptors are blocked, it may produce some central side effects. That's why buspirone may produce some restlessness in the patients. This condition is also called as akathisia, where restlessness is observed because of any extrapyramidal side effects that may be produced with buspirone due to its antagonistic activity on D2 receptors. Again, this side effect is not observed with benzodiazepines because benzodiazepines are not acting on dopamine receptors. So when the therapy switches from benzodiazepines to buspirone, again, restlessness can be observed in the patients because of antagonism on dopamine receptors. Third one is the effect on memory. We have seen that benzodiazepines mainly produce central side effects resulting in the loss of memory. These drugs produce anterograde amnesia, loss of memory of current events, which is more troublesome in the elder people. And it can also produce some muscle paralysis resulting in the decreased grip strength so that the patient cannot hold the objects in a perfect way. Even buspirone shows somewhat less central side effects like amnesia and muscle paralysis, but still care should be taken while driving the vehicles or operating with machinery because a high dose of buspirone may also produce cognitive and motor impairment, which may affect the daytime activities. So when this drug is used, particularly at high dose, caution should be taken, particularly in the elders. Fourth one is the effect of alcohol. Generally, alcohol acts as a CNS depressant. So when the alcohol is going to be consumed, it can act on the CNS, thereby it can produce some sedation in the patients. Even buspirone is not producing sedation directly, but when it is combined with alcohol, it can increase the sedative effect, which may be significant. That's why care should be taken when buspirone is co-administered with alcohol because sedative effect may be increased in presence of alcohol. Fifth one is the grapefruit juice. Buspirone is one of the active drug which is going to be metabolized to 1-pyrimidinylpiperazine piperazine by one of the metabolic enzyme CYP3A4 enzyme. This is the metabolic enzyme present in the liver which is responsible for metabolism of buspirone. Now this metabolite 1-pyrimidinylpiperazine piperazine is the active metabolite which is also having some anxiolytic activity with somewhat less action compared with buspirone. Now grapefruits can act as CYP3A4 inhibitors. So when this grapefruit juice is going to be taken at large amounts, it can inhibit the CYP3A4 activity, thereby it can inhibit the metabolism of buspirone. This results in the increased toxic effects of this drug which may produce increased central side effects and restlessness in the patients. So buspirone should be avoided with large intake of grapefruit juice. Sixth one is the effect of food. Generally, buspirone is having better absorption and it is given at an initial dose of 7.5 mg twice daily. So the initial daily dose is 15 mg per day. When this drug is given along with the food, it increases the absorption. So this drug can be given either with food or without food, as food is not having any significant effect on bioavailability of buspirone. So buspirone can be taken with food except large amounts of grapefruit juice and alcohol. Seventh one is MAO inhibitors. Non-selective MAO inhibitors like phenelzyne, tranylcypromine and isocarboxide, all these are acting like antidepressants, and MAO-B selective inhibitor such as selegiline which is used for the treatment of Parkinson's disease. One of the antibiotic linezolid, which is having the weak MAO inhibitory activity. Similarly, a dye like methylene blue, all these are having MAO inhibitory activity. And when these compounds are combined with buspirone, they can produce one of the syndromes, serotonin syndrome, resulting in severe hypertension in the patients. This is a fatal condition which should be immediately treated. That's why buspirone should not be given along with MAO inhibitors. And at least 2 weeks gap should be maintained with use of buspirone and MAO inhibitors in order to eliminate this severe hypertension in the patients. Eighth one, effect of other medication. Already we have discussed that buspirone is going to be metabolized to 1-pyrimidinylpiperazine piperazine by metabolic enzyme CYP3A4. Few of the drugs can affect this metabolism either by inducing or inhibiting the enzymatic activity. So drugs like ketoconazole, ritonavir, these are the strong CYP3A4 inhibitors, thereby they inhibit the metabolism of buspirone. When this metabolism is inhibited, it increases the levels of buspirone, resulting in the increased toxic effects. So these drugs, when they are combined with buspirone, they can increase central effects like sedation. Therefore, the dose of buspirone should be reduced in presence of strong CYP3A4 inhibitors. Similarly, few of the drugs like phenobarbital, phenytoin, carbamazepine, all these drugs are acting like CYP3A4 inducers. So they induce the metabolic enzyme activity, thereby they increase the metabolism of buspirone, resulting in the decreased efficacy of this drug. So when these drugs are combined with buspirone, they can increase the anxiety due to decreased pharmacological response of this drug. That's why in presence of CYP3A4 enzyme inducers, the dose of buspirone should be increased in order to produce significant anxiolytic activity. So these are the 8 factors that should be considered before taking the buspirone. Buspirone is one of the anxiolytic used for the short-term management of anxiety, particularly in the treatment of generalized anxiety disorder. But before taking this buspirone, few of the precautions should be considered. When this drug is used in the patients who are switching from benzodiazepine therapy, the dose of benzodiazepine should not be stopped suddenly, as it increases the withdrawal symptoms which are not affected by buspirone, because buspirone is a non-benzodiazepine. In addition, buspirone shows pharmacological activity after 1 to 3 weeks of the treatment, so it is not suitable for acute treatment. That's why the benzodiazepine dose should not be suddenly stopped. It should be tapered over few weeks where buspirone therapy is already initiated. And this drug should be carefully given along with alcohol and grapefruit juice, as it increases the central side effects. Along with CYP3A4 inducers and inhibitors, this drug shows some drug interaction where the dosage adjustment should be done in order to reduce toxic effects as well as to increase the efficacy of this drug. So that's all about important factors that should be considered during the buspirone therapy. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.